Have you ever felt the full wave of pleasure, but noticed something missing? That moment of release, that familiar rhythm your body once knew so well, arrives, but without the presence of semen. You feel the sensation, but not the substance. And in the quiet after, confusion seeps in. If you're a man over 60, this may not be something you ever thought you'd face. It's not something you'd bring up at dinner or even whisper about in the doctor's office. Yet it happens to far more men than you'd imagine. And the silence around it is costing many their peace of mind, their confidence, and sometimes even their joy. Hello, I'm Dr. Michelle Zion, and today we're having a real, science-based, heart-centered conversation about what's known as dry ejaculation, or climax, without the release of semen. This isn't about embarrassment or shame. This is about understanding your body's signals before fear fills the gaps. Because when you understand what's happening, you stop seeing it as a loss and start recognizing it as communication. Let's start at the beginning. Think of your body as a beautifully synchronized orchestra, every note, every cue, perfectly timed. In a healthy system, the testicles produce sperm. The seminal vesicles contribute the nourishing, sugar-rich fluid that gives semen its volume. The prostate adds a protective layer, a buffer of enzymes and minerals that help sperm survive. When you reach climax, a delicate chain reaction begins. The muscles around your prostate, bladder, and pelvic floor contract in rhythm, propelling the semen outward through the urethra. It's a process so precise that even milliseconds matter. Now, here's the key. Orgasm and ejaculation are not the same thing. Orgasm is the neurological experience, that intense wave of pleasure triggered by the brain and nerves. Ejaculation is the physical release of fluid. They usually happen together, which is why most men never realize they're two separate events until something interrupts that connection. And when that happens, when pleasure arrives but the fluid doesn't, it can feel confusing, even alarming. This is dry ejaculation, also called anejaculation. It's more common than most realize, especially after 60, and it has specific causes, most of which are treatable. One of the most frequent culprits is something called retrograde ejaculation. Imagine a valve, a small muscle at the base of the bladder that's designed to close during climax. Its job is to make sure semen flows one way, forward, out of the body. But if that valve weakens or fails to close properly, the path changes. Instead of moving forward, semen travels backward into the bladder. You still feel the pleasure of climax because your brain and nerves register that event. But physically, the fluid never leaves. It takes the path of least resistance, inward. Later, when you urinate, you might notice your urine looks cloudy or slightly thicker than usual. That's the semen mixed in. This often happens after prostate surgery or procedures for benign prostate enlargement, BPH. Certain blood pressure medications and antidepressants can also relax that same valve muscle. And men with long-term diabetes or spinal cord issues may experience nerve-related changes that cause the same effect. Retrograde ejaculation isn't harmful, and it doesn't mean you've lost your masculinity or desire. But it does change the mechanics of release. For men still wishing to conceive, this can affect fertility. But for most, the sexual experience itself remains intact. One of my patients once told me, "It felt like the pleasure was there, but the proof wasn't." That phrase, "the proof wasn't," captures how emotional this can feel. The body performs, but the evidence is gone. Yet once he understood it was mechanical, not hormonal or psychological, his anxiety lifted instantly. That's why understanding matters more than anything else. Sometimes the issue isn't backward flow, it's blockage. The seminal vesicles, located just behind the bladder, produce most of your semen. But if the ducts leading from them get blocked, that fluid can't exit, no matter how much your body produces. It's like a river dammed by debris. Pressure builds behind the block, but nothing passes through. What causes the blockage? Often, it's inflammation from past infections like prostatitis. Sometimes it's small calcified stones, similar to kidney stones, that form inside the ducts. Other times, tiny cysts or structural changes compress the passageway. Symptoms can be subtle, maybe mild pelvic pressure during climax, or noticing your semen gradually becoming thicker and less abundant before disappearing altogether. Similarly, neurological disorders such as multiple sclerosis, Parkinson's disease, or advanced diabetic neuropathy can interfere with the brain-body signals that trigger ejaculation. In these cases, you may notice not only dry climax, but other changes: weaker sensation, erectile issues, or numbness in the genital area. When in doubt, don't self-diagnose. Don't wait for it to go away. A simple evaluation, physical exam, urine test, and imaging can reveal what's really happening. Knowledge, not fear, is your protection. Now let's address what many never say out loud. For most men, ejaculation isn't just a biological function. It's tied deeply to identity. It's proof of virility, potency, manhood. So when that disappears, even temporarily, the silence that follows can be deafening. I've seen men avoid intimacy altogether, not because they've lost desire, but because they've lost confidence. The anxiety of, what if something's wrong, becomes louder than the voice of connection. But here's the truth. Dry ejaculation doesn't erase your masculinity. It doesn't define your worth. Your ability to love, to give, to feel, those are not measured in milliliters. The key is understanding what's happening and communicating with your partner and with your doctor. When you bring the problem into the light, it stops being a secret shame and becomes a solvable issue. And more often than not, it is solvable. So, what can you do, right now, to restore confidence and control? Don't ignore changes. A sudden shift in ejaculation or orgasm pattern is your body's way of asking for attention. Listen to it. Control the controllables. Keep chronic conditions like diabetes, high blood pressure, and cholesterol well managed. These directly affect the nerves and vessels responsible for sexual function. Prioritize movement and sleep. Regular exercise improves circulation, testosterone levels, and mood. Quality sleep boosts hormone regulation and recovery. Stay hydrated and limit alcohol. Both dehydration and excessive drinking affect prostate health and hormonal balance. Review your medications. Some blood pressure and antidepressant medications can interfere with ejaculation. Never stop them abruptly, but talk to your doctor about safe alternatives. Break the silence. Talk to your partner with honesty. Most partners don't care about the fluid. They care about connection. Vulnerability builds trust and restores intimacy faster than any pill. Seek professional evaluation. A urologist or men's health specialist can identify whether it's retrograde, obstructive, hormonal, or neurological. Once you know the cause, the path forward becomes clear. One of the most profound moments in my career came from a patient in his late 60s. He had lived with dry ejaculation for nearly 2 years and had withdrawn completely from his wife. When he finally came in, he was trembling with embarrassment. After a simple urine analysis, we confirmed retrograde ejaculation caused by a medication he'd been prescribed. When he realized it wasn't cancer, wasn't aging, wasn't the end, he cried, not out of fear, but out of relief. He told me, "I wish I hadn't spent those 2 years in silence." That's why I'm making this video, because no man should spend 2 years, or even 2 weeks, in unnecessary worry or shame. Your body speaks through signals, not judgments. Dry ejaculation isn't a verdict. It's an invitation to listen closer. Your vitality isn't measured by the presence of fluid. It's measured by your courage to seek understanding, your commitment to health, and your openness to healing. If you take only one thing from this message, let it be this: don't suffer in silence. Talk to your doctor. Talk to your partner. Your body isn't betraying you. It's guiding you. And when you listen, you open the door to healing, physically, emotionally, and intimately. I'm Dr. Michelle Zion. Thank you for trusting me with this conversation. If this message helped you, share it with someone who might need to hear it, a friend, a brother, a father. Because understanding saves relationships, restores confidence, and brings peace to the men who've been too afraid to ask. Stay informed. Stay compassionate with yourself. And remember, your best years aren't behind you. They're waiting, just beyond the silence